Good morning, friends. I'm Dr. George Michael again. Today, I'm going to discuss with you the shoulder pain. There are majorly 5 to 6 ton conditions may be there. One thing is avascular necrosis, bursitis, tendinitis, brachial plexus injury, thoracic outlet syndrome, cervical radiculopathy. And today, I'm going to discuss one of the main subject is called frozen shoulder. This usually affect the shoulder. And what is the basic reason? Because this is one of the major joint which usually we call ball and socket. It's one of the open joint. Now high mobility among the joints. So main reason this particular joint has been covered with the capsule we call shoulder capsule, the synovial we call. So because of three reasons. One thing is lack of blood supply to the capsule that forms the formation scar tissue which go and disturb the inside of the joint capsule, and this called the adhesion. Adhesion is nothing but attaching of the tissues. So that causes the very symptoms called the stiffness and the pain and the swelling. Usually the patient is not able to lift the hand, and any backward motion the patient gets more of the limited movements. So it has got the three stages. One thing is like freezing. Freezing usually the more severe pain in the night time. Second thing, it lasts about 9 to 12 months. Second is called frozen. Here the pain gets subsiding, but only stiffness remain long time. And last stage is the throwing. That is called the going stage. So you require the treatment in the two stages. One thing, a freezing stage and frozen stage. Okay, this is commonly seen in the patients. Those are suffering from the hormonal imbalances, low immunity level, the weakened immunity we call. Those are like after any illnesses, like anything stroke, surgery, mastectomy, okay, and not recovering from the long-standing illnesses. So they usually get that. And very importantly, commonly we see in the 10 to 30% of diabetic patient, this is commonly seen. Okay, now usually this can be investigated with two methods. One thing, MRI just to rule out any other possibilities of major illnesses. Okay, and usually X-ray which rule out usually anything arthritis formation, and usually one thing arthroscopy, they inject the dye and just see any surroundings areas as damage. The very important treatment usually when the patient they start with the steroid infiltrations. They start with the if you go to orthopedic, okay, they start with an analgesic, ibuprofen, paracetamol combinations, okay, and aspirin. Otherwise any local infiltration steroid they give, and usually the pain comes down and swelling comes down. Okay, and but usually if you don't treat internally. So now again my subject comes, the same dialogue comes, the best of science and best of homeopathy, the homeopathy medicines. Okay, these medicine depends on the adhesion is nothing but attachment of the tissues in the shoulder joint. Okay, formations of the scar, we have to prevent scar formations. When you prevent the scar formation in the capsule within the joint, okay, there are few remedies. Again, don't take this medication on the counter. You require a special homeopathy doctor's advice regarding this. So few remedies like which affects the periosteum, the bone, okay, that is called ruta. Okay, second thing is which affect the fibrous tissue or synovial tissue. There are few drugs like hypericum, acid sulfuricum, pulsatilla, phosphorus. And if it affect the any tendons, maybe bursa, it required the anacardium. So see, basically this is a bigger subject. It required a doctor's guidance. So when you take the medication, what usually happens, this usually prevents the scar formation within the tissue so that your joint gets more mobile. Okay, second thing is it prevents the inflammation, redness, and it increases the blood supply among the joint capsule. That is a very important factor. And once you take the medication, see, you require the medication in the first two phases. As I said, in the freezing stage, when there is a beginning of the illnesses. Second thing, you require a treatment when there is a frozen state, because thawing is the usual recovery stage. When you take the treatment, homeopathy medication, the first 2 months, if you take the medicine for maybe, according to our experience, my experience, maybe continuously 3 to 6 months, so your suffering will ended almost permanently. So thanks once again. I'll be back with the one more effective subject very shortly. Have a wonderful day.